rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Hello everyone, today I saw a patient with newly diagnosed brain metastases and an important treatment question came up. Should we pursue a more intensive local treatment strategy or would a less aggressive approach be more appropriate? To support that discussion, let's assess his prognosis using the Graded Prognostic Assessment, or GPA. Our patient is a 58-year-old man with 2 newly identified brain metastases. He remains independent in most daily activities, but his symptoms have reduced his Karnofsky performance status to 80. Current staging shows no evidence of extracranial metastatic disease. His overall condition is relatively stable, but the prognosis is not immediately clear from any single feature. Let's enter his clinical information into the GPA calculator. We'll begin with age. Our patient is 58 years old, so we'll select the 50 to 60 age group. This contributes 0.5 points. Next is the Karnofsky performance status. His KPS is 80, so we'll select 70 to 80. This adds another 0.5 points. Now we'll enter the number of CNS metastases. The patient has 2 brain metastases, so we'll select 2 to 3 lesions, contributing 0.5 points. Finally, we'll assess extracranial metastases. None have been identified, so we'll select none. This contributes 1 point. Everything has been entered. Now let's calculate the score. Here are the results. The patient's total GPA score is 2.5. According to the reference data, this score group is associated with a median survival of approximately 3.8 months. This estimate can help frame discussions about treatment intensity, symptom control, and overall goals of care, but it should always be interpreted alongside the primary cancer type, available therapies, and the patient's preferences. The clinical summary provides an easy-to-read overview of the result and the factors contributing to the final score. To understand how the score was calculated, we can also review the calculator logic. The GPA simply adds the points assigned for age, Karnofsky performance status, number of CNS metastases, and the presence or absence of extracranial metastases. If you need to use the assessment elsewhere, the copy button allows you to copy the result as plain text and paste it into your own clinical document. You can also enter a patient name and save the assessment within the platform. Once saved, the case can be accessed from the Saved Results panel on the right-hand side. If we scroll down, the reference data shows the median survival associated with each GPA score range. It is also important to remember that this is the original GPA model. Diagnosis-specific GPA tools may provide additional guidance for particular primary cancer types. If you found this case helpful, please like and subscribe for more oncology decision support tutorials. Thanks for watching, and I'll see you in the next clinical case.